Kirtida Oza from Sjögren's, India. I suffer from polyautoimmunity, which means I suffer from several autonomic conditions uh, added on over the last 30 years. I suffer from thyroiditis, which is fairly common, Sjögren's syndrome, which is not very rare, but in India, because it doesn't get diagnosed easily, it is considered rare and rather unknown. And I have been working for Sjögren's awareness and for patient support for the past 16 years. Recently, I also developed myositis, polymyositis, which is a muscle inflammatory disorder, again, a rheumatic condition. These conditions are usually adult onset conditions with no known cause and therefore no known cure as yet. The probable causes are a combination of genetic predisposition, environmental factors, and viral infections. The problems with dealing with these conditions and the lack of research, I'd like to focus on that. There is inadequate Indian data. The problem with numbers exists because there is no real data on how many patients we really have. So there is very little research on the Indian population, although now there has been a lot of studies coming out from several places, especially teaching hospitals, and things are getting better. There are very few studies which show how the Indian population is different from the Western population. For example, some of the Indian studies have shown that the onset of Sjögren's is at least 10 years earlier than in the Western cohorts. That is an important finding. Sometimes we have also found that the characteristic manifestations between the Western and the Indian cohorts have been different. Why is research important? Research is very, very important, especially in conditions which are like this, lesser known and rare. Better understanding of the etiology and the mechanism of the disease is important if we are trying to find a cure for these conditions. Many manifestations remain underexplored. In fact, one of the things that Sjögren suffers from is the fact that people think it's a disease of dryness, and they don't take it very seriously. Unfortunately, there are a lot of manifestations which have remained underexplored. There is no targeted therapy for Sjögren syndrome yet, and there is definitely no cure. So we have a lot of hope from researchers and scientists, and we do hope that we will soon have a cure for this condition. Looking at the patient involvement in research is what I would like to focus on. Understanding the patient's perspective is extremely important. I feel unless the patient's point of view is understood by researchers and by doctors, it is very difficult to find a satisfactory solution which influences the quality of the life of patients. Valuing patient experience is something that sometimes is missing from our Indian research or data. The impact of the disease on the quality of health, life is different as perceived by patients and by doctors. And we really need to understand not only the physiological impact of the illness, but also the social impact on education, the impact on careers and life, and financial implications. One of the things that I feel would help is to have collaborative research. What do I mean by collaborative research? When I'm talking about collaborative research, I mean that patients should be involved in studies that scientists and doctors are doing. there is a world of wisdom that the patients have in terms of experience, and I think that needs to reflect in research processes also, especially in clinical research and translational research, which, if the patients are involved in translational research, the application of whatever the findings are is possibly easier to communicate to the community. Another thing that I would like to recommend is we need to encourage and value citizen research. What do I really mean by citizen research? It is still a relatively lesser known term here. It is like, just for a small example, I did a study on the members of Sjögren's India. This is a small study that I did and presented yesterday at the Indian Rheumatology Association's conference. And what came out is that the symptoms and severity as expressed by the patients is slightly different from what doctors considered to be important symptoms. It was interesting to note that patients look at quality of life as being dependent on what bothers them the most on a day-to-day basis, whereas for doctors, the most important symptoms are those which are either organ threatening or life threatening. Also, another interesting aspect was the impact of Sjögren's on the lives of patients. And it was a startling revelation that nearly 40% of patients told us that their careers had been impacted, their personal lives had been impacted, that social interactions with friends and family had been impacted. So these were some of our important findings. Uh, This is just a poster. It doesn't show you much, so I'm just going ahead. I'd like to end with opportunities for patient in research that we need to focus on. We need to find opportunities where patients can do study and research at university levels. For example, at Oxford University, there are opportunities for patients to pursue a PhD degree in the disease that they are suffering from. In fact, I'd like to tell a little story about Rosamund Snow, who was a scholar at the Oxford University, and she studied her own disease, which was type 1 diabetes, and she came up with some amazing results. Finally, she also was asked to teach at medical colleges, and she became a very, very important part of the patient education program, having discovered a methodology which helped uh, keep diabetes in better control. Rosamund Snow unfortunately died young, and her family has instituted a scholarship in her name, which today offers uh, a patient to do a PhD on their own study, on their own disease. Another wonderful opportunity that I learned of is that the British Medical Journal actually has a patient editor. Things like this must be provided in India, because patients do have a lot of valuable knowledge and experience, and I think it's important that we give them an opportunity to share. So with that, I'd like to end my little sharing and thoughts, and I look forward to meaningful research collaboration with scientists and doctors. Thank you very much.